a liver test. Most people that have worked in factories that produced Kepone or produced Roundup, produced dioxin or any of the other chemicals, take a liver test. There's liver damage there. There's probably, it's still remaining in fatty tissues of the body, because I don't think it leaves the body. Once the body absorbs it, it stays there. And we wonder why it's just this epidemic of lung cancer in people 35 or 40 years old who have never smoked. You know, who've never smoked, who've never inhaled cigarettes, who've never been around secondhand smoke. You know, and these are the people that are coming down with fatty tumors. They're coming down with lung cancer, respiratory, asthma, all these things from this environment. This is something that maybe happened to them 20 years ago, and they're not going to make the connection of what happened when they were 20 and they're in their 40s now, that they received a dose of whatever it was in the air or whatever was in the water, and the pipes. Most of the pipes in the United States are 100 years old. You know, most of the major water pipes of all the water companies are 100 years old. So I'm sure there's a lot of lead in there. I'm sure there's other gunk that's built up over the years. You know, I don't think our water system is that good either, you know, for that matter. And I think a lot of it is waterborne, and a lot of it is airborne. And I just see the problem just escalating, and there's going to be more illnesses. More children have asthma, more children have ear infections, you know, more children have strep throat. Childhood illnesses that did not happen to me or my child are now happening to children today. Everywhere is always a sick child. The pediatrician's offices are full of sick children that are chronically sick from the day they've been born.
Yeah, you know, when I started campaigning, I was asked, do you know anybody who's died of natural causes? And we were talking about the chemical industry and pollution and all that, and I couldn't answer that because I don't know anybody who has died of natural causes. There's been something else. There's either been a heart attack caused by overindulgence, that there's been cancer caused by impact of chemicals or smoking, and I'm sure smoking does cause that. And now what we're seeing now, do we know any child that doesn't have an illness? And that's difficult now to say no, isn't it?
Yeah.
You know. Okay, Charlotte, we'll go straight into your presentation, and we look forward to getting more presentations from you in the future.
Okay. And I enjoyed talking. You have a good day. Okay.
Yeah. Same to you.
Okay. Talk to you soon, Andy.
Okay. Bye.
Bye. Hi, everyone. This is C.M. Leslie, environmental correspondent for the Edge Broadcasting Network. My first topic tonight deals with the superbugs that are resistant to antibiotics, and I have entitled them The Deadly Duo: Supergerms Hiding Where You Least Expect Them. For a number of years, methicillin-resistant Staphylococcus aureus, also known as MRSA, has been dubbed a superbug because common antibiotics could not eradicate it. This sometimes fatal bacterial infection haunts medical centers and nursing homes, mostly targeting the elderly and chronically ill patients. Now in 2008, we have an even more dangerous form of staph infection, community-associated MRSA, commonly known as CA-MRSA. For the past year or so, CA-MRSA has become almost an epidemic that is sweeping the country. Dr. Robert Dawn, an infectious disease specialist at the University of Chicago Children's Hospital, was among the first researchers to discover the community strain. Community strains are genetically distinct from ordinary hospital staph infections. Unlike the hospital bugs, they also produce toxins that rapidly kill off white blood cells, the body's main infection fighters. This makes CA-MRSA a double threat. It's just not a question of administering the correct antibiotics. MRSA is so widespread that 2.4 million Americans carry the bacteria in their bodies without any symptoms, the CD reported. This is the Center for Disease Control in 2006. CA-MRSA carriers infect others and suddenly become ill themselves if the bacteria bypass the body's immune system. Any break in the skin's protective barrier, a razor nick, scratches, injuries to nasal passages could set the stage for staph infection. Labeled a serious threat to public health as far back as 1999, the superbug is now responsible for over 60% of skin and soft tissue infections seen in emergency rooms. Experts on CA and MRSA are now advocating increased government funding on the development of newer and improved antibiotics to fight the bug, or better still, a vaccine to prevent it. Many feel CA-MRSA is more of a threat to public health than the bird flu. The drugs that healthcare experts have relied on no longer work. CA-MRSA will definitely morph into something more resistant to the current array of antibiotics. CA-MRSA typically causes boils, pimples, or pus-filled swellings, often mistaken for common insect bites. CA MRSA is usually spread by skin-to-skin contact. For example, during sports such as football and wrestling, including handshakes and even simple hugging. The Center for Disease Control recommends these steps to lower your risk of contacting CA MRSA. Keep your hands clean. Washing with soap and hot water several times a day is the single most important way to combat staph. Encourage your children to keep their fingernails short and discourage them from picking their nose, which may cause injury to nasal passages. Cover cuts and scrapes. Immediately wash any wound with antibacterial soap, then cover with dry, sterile bandages. Apply clean bandages daily until the wound is healed. It's important to wear gloves while changing the bandages and always wash your hands afterwards. Don't share personal items. Teach your children not to share towels, washcloths, shoes, clothes, makeups, or drink after each other. People who appear perfectly healthy can still be MRSA carriers. Don't share sports equipment such as helmets and gym mats, and spray them with disinfectant immediately after every use. Sanitize your gym clothes and linens. Wash uniforms in hot, soapy water to which 1/4 of a cup of Clorox bleach has been added. Dry your laundry in the dryer and not on the clothesline. Get tested. If you have a skin infection that does not heal or is pus-filled and red, ask the doctor to check you for MRSA. Be sure to take all your prescribed medication, even if the skin infections heal completely. Any remaining bacteria alive today can morph into serious superbugs tomorrow. Don't be afraid to speak up, and never allow a healthcare worker, dentist, nurse, or laboratory technician, or anyone connected to the healthcare field to examine you without first washing their hands. This is doubly important in emergency rooms where in the rush to tend to patients, simple precautions are often overlooked. Insist on it and be firm about it. My next one has to deal with C. diff, and this is a relatively new infection, bacterial infection that's catching up with MRSA. Bacterial infection is pronounced Clostridium difficile, known as C. diff. It is a NAP1 type of bacteria, a mutated version. As a matter of fact, it produces approximately 20 times the toxins responsible for illnesses ranging from simple diarrhea to acute blood poisoning and death. C. diff has long been a common, almost run-of-the-mill bug, usually associated with simple but easily treated diarrhea in older people and in the elderly who live in nursing homes. About 5% of healthy adults carry the bacteria with no ill effects, but overuse of antibiotics has allowed the germ to develop resistance in the past few years, creating a new type of toxin that resists traditional treatment. C. diff produces an anaerobic spores which are transmitted through feces and are available to survive for months on most surfaces. People are affected when they ingest the bacteria, typically by touching contaminated surfaces. In 2005, 300,000 cases of C. diff associated diseases were logged in discharge records of some of the nation's leading hospitals. Of the 300,000 cases recorded, 28,000 people who had the disease died. This is at best an inaccurate record because nursing homes and other facilities were not counted in the overall estimate. Contaminated healthcare settings remain the #1 carrier of C. diff infections. The NAP1 strain has been found on other sites the past 2 years, infecting young adults and ravaging pregnant women with no history of antibiotic use. What is clear is that the most toxic strain is taking hold, according to Centers for Disease Control. Health officials now rank C. diff on par with MRSA as one of the top 2 infections acquired in hospitals and nursing centers. There is no question that the rise of C. diff can be traced to the nation's hospitals and the lack thereof of basic germ care production. Nearly 40% of hospital patients diagnosed with C. diff tested positive for the bacteria on their hands. Hospital germicides and alcohol sanitizers don't kill C. diff. It takes bleach and a hard scrubbing to remove the bacteria. The biggest problem in hospitals is that hospitals are filthy. If healthcare officials can start cleaning up the environment, the infection can be controlled. In the meantime, patients need to take matters into their own hands, literally. Wash your hands. Ask visitors and healthcare workers to your room to wash their hands as well. No matter how dirty the surroundings of your environment is, if the spores do not get into your mouth, you will not get C. diff. So until a better solution can be had, patients will have to pretty much be responsible for cleanliness and basic sanitation. An ounce of prevention is the best advice from the healthcare officials at the Center for Disease Control. Thank you. My next report is entitled Vacation, All I Ever Wanted, and I've entitled this Summer Vacation, Playing It Safe. Each year, millions of vacationers will return home with more than a perfect tan, photos, and memories of the trip. Many will return with nausea, stomach cramps, projectile vomiting,